Developmentally, it is all asexual reproduction. Even today, the majority, the largest biomass on Earth is prokaryotes. They still continue to reproduce by asexual reproduction. Sexual reproduction came in later, but initially they were all carrying both the apparatuses, eukaryotes. The sexual differentiation came much later in the evolution of life on Earth, and sex became an important entity. And of course, in some species, the male member pays a huge price for it. It is only in the last century that sex was de-linked from reproduction. With the introduction of contraception, it is possible to have sex with no risk of reproduction. It's even later, only in 1978, when with IVF, we could have now reproduction without sex. And ethics is a human invention. The primary purpose of ethics is to protect the weak and the strong, and for the manipulation by the powerful. Ethics is a very simple thing, but simple doesn't make it easy. All of us know many simple things are not easy to practice. It's easy to preach, but difficult to practice. The famous quotation is, "Do unto others as you would like them to do unto you." Most of you, I'm sure, will follow Tamil. That's the nice quotation which says, "Unnai pol pirare ninai." Ethics is the science of morality. There is no uniform morality, therefore there cannot be universal ethics. There is nothing ethical applicable to all over the world. Medical ethics is the correct professional conduct with regard to the physician himself. You have every right to refuse a treatment if you apply the same formula to everybody. Even these vary from time to time, country to country, and from state to state in some countries. Why should we bother about assisted reproduction? This question was asked to me when I came back in '87. I was trying to establish a department in Madras Medical College. The health secretary asked me, "Why are you bothered? Our country is overpopulated." Unfortunately, though we are overpopulated, there's a huge concern about the infertile people. Human reproduction, despite our concerns about overpopulation, is hopelessly inefficient when compared with other species. Our population is growing not because number of people are reproducing more, it's because they reduce the death rate. 15% of all married reproductive age couples are infertile. Almost 70% of these people require some form of assisted reproduction. Technically speaking, assisted reproduction is in vitro manipulation of the oocyte and the spermatozoa. IUI is not, technically speaking, assisted reproduction, but in common parlance, we use that also. The first case was reported in 1978 by Edwards, Steptoe, and Purdy. Later on came in Palermo, introducing ICSI, intracytoplasmic sperm injection, in 1992. The word artificial insemination and artificial reproduction are misnomers, nothing artificial about it. Well, after the advent of IVF and ET, in vitro fertilization and embryo transfer, a plethora of technique came. We call it alphabet soup. The numbers are too many, in fact, more than 14. I will not list them here, but it's to say that most of them died a natural death. And what remains today is only IVF, ET, ICSI, IUI. Others have all slowly died. That is Professor Robert Edwards, who was condemned by the people who discovered the structure of DNA, saying that what he's doing is unethical. They told him, "You're going to create a Frankenstein monster." Today, we have more than 8 million babies born all over the world with no evidence of a Frankenstein monster. That's Professor Edwards. There's a lady who dared. She was a lorry driver's wife who was told that she had a 1 in a million chance of having a baby by IVF. She dared. She went to and had the treatment. And that's the first IVF baby, Louis Brown. And that's her baby, conceived naturally. That was when Professor Edwards was in Chennai. He was in Chennai as our guest and we gave him for the sake of honor award in Rotary. That's Professor Anand Kumar, the architect of India's official first test tube baby. That was me younger days. The Universal Declaration of Human Rights is very clear. Men and women of full age without any limitation due to race, nationality, or religion have the right to marry and to found a family. They are entitled to equal rights as to marriage, during marriage, and its dissolution. Marriage shall be entered into only with the free and full consent of intending spouses. The family is a natural and fundamental group of the society. And this is a declaration from the ICPD. To be able to reproduce and raise a family is one of the fundamental rights of every individual in this world. This is what raises a lot of issues. But I was asked to write a commentary by Professor Edwards on embryo sex selection. That was practiced for a short time until the Supreme Court intervened and prevented it. This is the commentary I made. When to reproduce, how many children, and how often to have children are all very personal decisions. You remember the backlash after the introduction of compulsory sterilization in the 70s. Medicine is a social science. It should address the social and cultural ethos of the community it serves. It is not like physics or mathematics. And in ART, we have an ethical minefield. When we talk of ethics, we are opening a Pandora's box. I'm sure I'm opening a Pandora's box today. Every ethical ART technique has an ethical dimension. Many ARTs have huge ethical ramifications. Now, during the course of the next 35 minutes, I will touch upon the various aspects. Thank you very much for the feedback. I think unanimously, all of you agree that reproduction is a fundamental right. The next question is, if it's a fundamental right, whose right it is? We'll come to that in a minute. And this, again, you all answered very well. It's of course, there's been a distribution. There's a big debate about whether it's a disease or a disability. Technically speaking, it's a symptom. But the cause could be the disease of the reproductive system. But it's not a disability. It is certainly a disease, or it could be a symptom of a disease. Who owns the embryo created by nobody voted for government? I ask this question because what happens when the embryo is unclaimed? We'll touch upon it. Do embryos and fetus have rights? Again, I'm very glad people voted for both. Embryos and fetus do have rights. Children's right, again, Vidya, will you be able to get the polling results later on again? Children's right versus parental rights. Decided, I'm glad all this will address during the course of the talk. Yeah. Now, the new entrant to this ethical debate is ethics of uterine transplant. People have started doing uterine transplant the world over. About 60 to 80 cases have been done so far, and all of which raises another ethical issue. We addressed this question of its reproduction a fundamental right long time back. And this is what we wrote, this is a peer-reviewed article. You can look up the article when you find time. If you say it's a fundamental right, is it of a single man? Single woman as a group? Is it a right of the homosexual man, woman? And what happens when a transsexual walks? If it's a fundamental right, are we duty bound to treat these people? As I mentioned in my initial introduction, I do not know. I have not had this experience of a single man walking in, but I had this experience of an interviewer live asking me this question: what if tomorrow a single woman walks into your clinic and asks for donor insemination or heterologous insemination? I didn't have the answer at that time. This was 1988, much before any guideline came in literature. There's no HFEA, there is no ICMR guideline. So these are issues which will crop up. Days are changing now. So transsexuality has become a reality today again. What if a transsexual comes and asks for the fundamental right of being able to reproduce? Should we be offering ART to HIV positive couples? The ASRM said a few decades back that you should not treat them because their lifespan is limited. Today, we know the lifespan is not limited. It's considered a chronic condition, a treatable condition, and therefore should we be treating HIV positive men, women? All these are issues which are slowly being resolved with advancing in science, but still we have no answer for mentally impaired. What degree of impairment would you allow to be treated, and what happens if it's a man or a woman? Do we have different standards? Is there anybody? Luckily, nobody believes that it's not a fundamental right, so I will not raise this issue. Again, physical impairment. We have had patients who had paraplegia, quadriplegia. They all can be treated today. You can recover sperm from the testis and do IVF ICSI. So should we be treating them, or should we be sitting in judgment and say no? These are issues which will crop up. All of you practitioners will face it. And we've gone one step further now. You can recover sperm from a comatose man, or even a dead man? Should we be doing it or should we not be doing it? Issues which are cropping up. Already there are people asking this question. So I am not very sure I could decide on this because these are issues which are of larger dimension. And then today in Israel, the
video has gone off, sir. Sorry to interrupt. Your video has gone off, sir.
Video is gone, is it? Let me see why. Okay. Is it on now?
Yeah, we can see.
Okay. Yeah. So in Israel, government is offering now soldiers who die in the battlefield or there's no battle are offered posthumous sperm recovery, and the sperm is stored. Later on, some woman can come forward to have the baby. So all these practices should be thought of or should be condemned. Now we have an embryo. More than several million embryos are stored all over the world in cold storage, in liquid nitrogen. Who owns the embryo? I'm glad the answer was couple, most of us. Nobody wanted to answer government. Somebody answered, some people answered clinic. What happens when the couple separate? And this is happening. This is happening all over. I thought India's conservative things don't happen so often in India, but I find that couples do separate in a large number even in India. In US, the estimate is 25% of all married couples separate. Does the embryo now belong to the woman, the man, both, or neither? And if they don't want the embryo, they don't want to claim the embryo, what does the clinic do? We just throw it away? Should unclaimed embryos be destroyed, donated, or used for research? If abandoned children are the responsibility of the government, are not abandoned unclaimed embryos responsibility of the government, or should the clinic be held responsible for creating such an embryo? Do embryos have rights? This is an issue which happened in Australia. A rich couple who went through IVF had the embryo stored, not achieve a pregnancy the first time. They're planning to go back and have an embryo transfer. They died in a car accident. But the embryos are in cold storage. Do the embryos have rights? The court said yes, they have rights, and the embryo will inherit the property as and when somebody comes forward to surrogate the embryo. And do the embryos and fetus, if they have rights, whose right is predominant? And if the couple decide to throw away the embryo jointly, will there be, if embryos are alive, are we being accused of embryonicide? If scientists, today we all know, embryonic stems are very crucial for treating many diseases. If we cull out, and it's still a potential life, if we cull out the stem cells, would the embryologist being accused of embryonicide? Do embryos' rights supersede parental rights? Children have sued the parents for wrongful life. A mother was an alcoholic, but a child with fetal alcohol syndrome, the child sued her, saying that you have damaged me. The fetal rights supersede parental rights. The courts are grappling with this problem, and I don't have an answer clear cut for you. I would welcome your reply or response during the discussion. Initially, things are all very simple. Reproduction involves just two couples. It is almost always a married couple or at least living together couple. And IVF was introduced as a technique for bilateral tubal damage, irreparable tubal damage. Later on, things have started getting complicated. Today, we're talking of an individual reproducing or uniparental reproduction. You can have a third-party reproduction with donor egg, donor sperm, surrogate, 4-parent reproduction, 5, 6. Things are getting more and more complicated. With all these complications, huge ethical issues also crop up. Such conflicts were not common, but have started happening now. Now, do the children have a right to know their biological parent? Even the foster parents decide against it. After all, we know until they reach adult age, the parents decide almost many things for the children. Now, if the child has got a right to know the parents, who the parents are, who the biological father or mother is, and the parents are against it, where do we stand? Now they are finding out their origin by looking at all this genetic testing. Now again, the right between donors' right was offspring's right. The children have a right to know their biological parents. The donors have a right to know who their biological offspring are. And this became a big issue. The first country to reintroduce this legislation was Sweden in 1988, they said, at the age of 18, we are going to disclose to the child who's the father. So all the Swedish donors stopped donating. There's a huge crisis. Swedish couple had to go to the neighboring countries to have donor insemination. Now, do the donors have any responsibility to the offspring they reproduce? And if there's something goes wrong, if everything goes fine, there's no issue at all. Something goes wrong, what is the situation? Well, what is often being blamed about assisted reproduction is many ethicists, religious leaders, and theologians object to assisted reproductive technologies. They feel doctors and scientists are playing God. I'm sure most of you agree with that. This is not a true statement. We are not playing God. They also believe that we are meddling with nature. After all, science has been meddling with nature, or human being has been meddling with nature ever since we came out of the cave, started using fire, and invented the wheel. Playing with life. Yes, science does play with life, not in the sense of playing, in the sense of improving life. Creating life, we are really not creating any new life at all. This is a common fear, playing God. We are not. What we are doing is, if you believe in God, God created all things on earth. You believe in nature, it has been in nature that all things existed on earth. No human being has ever created anything entirely new on earth. Not even an atom. We can't even create an atom. We created new things with existing things, therefore, we can't take the mantle of the creator. In A.R.T, when nature fails, medical personnel help couple reproduce by bringing the spermatozoa and egg together. It's as much like when vision fails, we use glasses to improve vision. Doctors and scientists are not playing God, but are doing God's bidding by helping millions of couples achieve a baby. And as on date, there are more than 8 million babies born all over the world. And we have meddled with nature since time immemorial. There are millions of things in our daily life which meddle with nature in one way or another. All these and many more meddle with nature, much more than assisted reproduction. Every new invention discovery has been received with a lot of reservations or even open condemnation. Some of you may be familiar with this person. For the non-obstetrician, he did, I would personally think, the maximum contribution to the practice of obstetrics. You look it up because it's worth, but he lost his life for stating that such simple statement. And this is what happens. People object to anything new. We are afraid of change. Even painless labor was criticized. Professor Edwards, I have personally known him for a long time. When I was talking to him, he used to tell me how much he was criticized by the famous, as I told you before, discoverers of DNA. That's the kind of criticism. People are, by nature, knee-jerk reactions to condemn any new thing. Are we playing with life? Yes, we are playing with life, not to play with it, but to improve it. Every new discovery or invention is to either save life or enhance the quality of life. And what really is life? I could not find a clear definition of it. In fact, I was giving a talk to the students at school. This question nobody could answer. I mean, I could not answer. They asked me this question again. What is your definition? I don't know. There are more than 100 definitions of life, none of which is entirely satisfactory. And remember, life has existed on planet since time immemorial. We do not know when does it begin and when does it end. It does not end with us. That's where metaphysics is very important. Your body is not you. You already passed on your genes, for most, at least, people who have had children. Passed on your genes, and genes is the fundamental unit of life. You have passed on your genes to your children. And therefore, life is a continuum with no beginning or end. If this is not life, they can't see a more life cell than this. What could be life? Embryo. When does life begin? Does it begin with the spermatozoa, the whose side, the zygote or embryo? We have no clear answers for all these things. And we have not created any new life. After all, what we do in assisted reproduction is bring two cells, the spermatozoa, you can probably call them half cells, and bring them together and create another life cell, the embryo. In the real sense, no new life is created. Now, after IVF became a common practice, we started extending the indications. From bilateral retrieval block, we started treating people with Turner syndrome. We're treating people with Klinefelter syndrome, all kind of conditions where previously they were considered to be irreparably or they are infertile. Now, older mothers became a big issue, big international issue. Where I had to address a conference in London in 2010 on how old is too old. How old is too old? I think Vidya said he had an arbitrary number, 30, 40, 50. I think the poll was 50. There are still people saying that at 50 she could have a child. How old is too old to be a surrogate? Is there any age limit for mother as a surrogate for daughter? This has happened several times in the history. Mother as surrogate for homosexual son. Father, brother as sperm donor. All this may bring in revulsion in some of you, but these are real life happenings. A mother at 70 is not having a child for fun. People will condemn him. She is attending to a very important biological need or a pressure. All of us know the pressure on a woman in this country for not having a child. So this lady is not doing it for fun. She's not doing bungee jumping. She's not doing skydiving. Yet we condemn. How old is too old to be a surrogate? Mothers have born children for their daughters. Is that wrong? She's offering. The only condition should be she medically fit. Mother as surrogate for daughter. What is wrong about it? If all the parties concerned are willing for it. Mother as surrogate for homosexual son. This is not incest. People mistake. This is not incest. She's only carrying the baby because he did not want to go to Emirates. And father, brother as sperm donor for homosexual daughter. Today, this has become a reality in UK. HFA allows known donors after taking written consent, and brother as a donor can be used in according to HFA guidelines. We address this issue again on older mothers. Again, it's a peer-reviewed article. You can look it up. And we feel that age should not be the only criteria. I'm not saying any age. All I'm saying is if she's medically fit, whatever be your criteria, and she's willing to carry a baby, she should be allowed to carry a baby as a surrogate or for her own or for her husband or family's development. Designer baby is really a non-medical terminology, like test tube baby. It's the imagination of a journalist who decided to use the word designer baby. You really can't design a baby yet. We get all that has happened in science was an HLA compatible baby was developed. It was my colleague in the RBMO as one of the editors. Urli Verlinsky is the name of the person. They had an HLA compatible baby created through IVF so that the baby could help its siblings which had a condition called Fanconi anemia. So the cord blood was used to cure the condition. That is what made the headline calling us this designer baby. And given the choice, I think most parents would like to choose as many features as possible. Please remember, even today, many practitioners are aware that the mother-in-law would give kungumapu, the mother would give for the pregnant woman to have a fair baby. We all know it doesn't work. It's not true. But still that in common practice, I've heard even gynecologists using it. And we have always some example in our mythology. Almost all A.R.T is nothing new for our mythology. But Markandeya is a classical example, where the couple wanted an intelligent child and not an average child. The intelligent child outwitted Dharmaraja. The third-party reproduction is very complicated. We don't realize the complications of third-party reproduction when we just practice it. It's a lot more complicated than what we imagine it to be. It involves spermatozoa donation, oocyte donation, gestational surrogate, genetic surrogate, intrafamilial donation, surrogacy, and it goes on with fourth, fifth, sixth, and reproduction. If this is not enough, there are a lot more issues waiting for us to be debating on a future date. Uterus transplant has become a reality now. It's not experimental anymore. Only thing, it is not available universally because it's a very complicated procedure, expensive procedure, and there are a lot of ethical issues involved. Embryo editing, you remember the fate of the person who did it in China. We'll have a lot of discussion about that also if we have time. Donor anonymity is another issue. Should the donor anonymity be revealed? Should not there should be no more government is a big deal. And this has become with industrial production of IVF babies. Unfortunately, it has become an industry now. People are doing so many IVFs per day. Wrong embryo transfer has become a reality. It is not a very evident problem in this country because there's not a huge racial differences, or this has become an issue in a country like US where the black embryo goes into a Caucasian couple, the children are born. This is another big issue. And another issue is about surrogates' right to terminate the pregnancy. Surrogates are cocooned now. What if she's in trouble? Does she have a right to terminate the pregnancy? Now we'll just have a few case studies just to highlight how we face this in our daily practice. This was in the year 88, before any guidelines existed on earth. There's no HFEA, there's nothing at all. This was the early days. I just come back from England. I started my practice in Apollo Hospital. A couple came in, husband was 25, wife was 21. He was azoospermic. He had no sperm in his semen sample. Biopsy revealed a condition called germ cell aplasia or Sertoli only syndrome. He had no germ cells. In those days, there was no other method of attempting treatment for this man. The sperm retrieval from the testes, which we also contributed in developing, came in much later. The hormone was markedly elevated, no treatment was possible. As is our practice all times, we counsel these couple when they have no option, offer them these options. Adoption, leave things alone and accept a child-free state, or think of donor insemination or heterologous insemination. The couple went back home and came back and opted for donor insemination. And the strange thing in India is, it's often a family affair. All other countries, you find the couple walk into your clinic alone. In India, it's the couple with the parents on both sides, sometimes the uncles walking in. And when they came in, the father wanted to talk to me alone. He said, my son told me that this situation, I want to be the donor. I was struck. I was not mentally prepared, and we had no way of going about it. I was struck, and I told him, no, it cannot work that way. I told him, your son has to think about it. The next day, the husband came and told me that he is willing for it, and he had no objection. Again, I was struck. I told him, no, it can't work that way. Your wife has to decide. The third day, she also came and said, I have no objection. So all the three parties concerned agreed to the position. I was not mentally prepared. So I went back to the lawyer of the hospital. The lawyer was not prepared, and he went to a senior lawyer in High Court. Nobody could give a guideline. So I was struck. I did not know what to do, whether I should go about it or not go about it. So I really was lost by the time the couple got dissolution with me and left. Today, the guideline, even today, father is not allowed. HFEA allows brother to be a donor in case he is counseled adequately and all parties concerned are willing. And this has really happened, what I told you before. A couple underwent IVF, spare embryos were frozen. 3 years later, they divorced. Husband remarries and wants custody of the embryos. Wife refuses consent and wants another child through embryo transfer. She's had breast cancer and chemotherapy. This was before fertility persuasion became a common practice. Even today, it's not a common practice in many centers all over the world. She claims having this embryo is the only option of having a child. Husband refuses. What do we do? The consent form was very simple 30 years back when we started practicing, or 87, 88. Now it's become very complicated, and it's a huge consent form with so many clauses. So consent forms are getting complicated, and the courts are not able to solve this problem. Again, this was the 90s. Several British clinics dumped 30,000 embryos down the drain because they could not contact trace the couple and arrange for their storage. Remember, these are potential life. Either you could donate to somebody else or use it for research. Should they have thrown it to the dustbin or thrown in the drain? With the right in doing this, what is the fate of these unclaimed embryos? Are not unclaimed embryos the responsibility of the clinic or the government? I would say government, because if unclaimed children or orphan children are the responsibility of the government, sure it should be the unclaimed embryos. And these are potential life, as I told you before. They are capable of at least being offered for research. We could get the embryonal stem cells from them. If when we talked about fundamental right, I didn't raise this issue. We had limitation of questions. So does a prisoner have a right to reproduce? The prisoner decided that he has a right to reproduce, and he wants a semen sample to be sent to his wife insemination. The prison authorities have refused. As most of you know, all prisons are porous. So this man managed to get his sample across through his own means. The prison authorities intercepted and destroyed. Was this action justified? Do prisoners on long-term imprisonment have a right to reproduce or not? I heard that today in some jurisdiction, they offer conjugal rights to some of the prisoners on long-term imprisonment. This happened in our own practice. A couple had IVF with us. The couple signed for discarding the embryos in the event of death of one of the partners. Consent form is a very painful affair. You just imagine they come to you to have a child, and you're counseling from IVF, telling the techniques, all these things. When it goes to consent form, we need to ask this question: what happens if one of you die? What happens if both of you die? All this is a reality which we face. And unfortunately, the husband died in an accident after the IVF has been done and the embryos have been frozen. A few months down the line, mother of the husband, the deceased, came and told, I want my daughter-in-law to have the transfer of the frozen embryos. Now remember the consent, they both decided to throw away the embryos in the event of death of one of the partners. The mother-in-law wanted the embryo to be transferred because that's her son. So what should we do? At this stage, we at least said, no, it's not you can decide. Your daughter-in-law has to decide about it. Then if the daughter-in-law has turned up, she has not turned up so far. If in case she turns up and asks for the embryo to be transferred, should we be doing it? Remember, the initial consent by both of them was to discard the embryo. Now she is alone. She wants a claim for the embryo. Should we be doing it? I wait for your answer. Mixed placed embryos, mixed up embryos are all happening all over the world. It's evident in some places, not so evident in other places. What happens when the embryos are misplaced in the wrong uterus, and that is recognized during pregnancy? Should the woman who is carrying the wrong baby has the responsibility to carry the pregnancy? She's carrying an IVF pregnancy. This could be the only chance of the other woman having a baby. If she refuses, can she be forced to do it? And if she can't be forced, is she being unethical in destroying someone else's embryo? Recently, several embryos were lost in American clinics due to some natural disaster. And it is lost, is it loss of property or loss of life? The doctors are being sued for both. Some are suing them for loss of property because it's their property. Some are suing for them because their only chance of having a baby has been lost by loss of life. So this is a real life situation. If this is not enough, we're talking of a mitochondrial transfer of 3-parent babies. 3-parent babies is slightly different from third-party reproduction. Here, only the mitochondria is used, or the cytoplasm is used. And this is primarily meant only for families where there's a mitochondrial disease. Now, all this complication, as I was telling you last talk, who decides? We often say it's society, the world. Remember, you and I are the society. We are the world. We cannot escape it anymore. I was part of the ICMR committee initially, and we had a lot of discussion about many issues. Who draws the line that this far and no further? All this Lakshman Rekha is written by us. We have to take responsibility for many decisions, and many decisions have to be overturned also the changing times. If this is not enough, this is another issue cropping up. In fact, cloning was an issue. I discussed with the clinical scientists in Edinburgh about reproductive cloning. In fact, we had a paper in reproductive cloning in the Hindu some time back with the public. Reproductive cloning has become a successful practice in animal kingdom. It's still being prevented in human beings for whatever reason. Therapeutic cloning has a lot of potential that's being allowed now. And today we're talking of in vitro germ cell production, stem cell therapy, gonad transplant, all this is becoming. And with the passing years, would man become redundant? We are talking of a diminishing Y chromosome. Scientists are scaring us, saying that Y chromosome is going on to become smaller in size. And there are also issue of diminishing sperm production, both of which are not proven entities yet. Should man become redundant soon, with in vitro germ cell production. This is a cartoon which came in Indian Express a long time back. This is, I think, in 90s. This has become a reality today as far as sperm is concerned. Today, sitting in Gumudi Pundi, you can order for a sperm from California Sperm Bank. They will transport to anywhere in the world if you are willing to pay for it. You can specify the nature of the sperm you want. This may become a reality in years to come with embryos too. But this is a cartoon again from, I can't remember where I borrowed it from, saying that this may become a reality. This is a cartoon caricature one of my friend drew about me at our 50th reunion. All this is becoming a reality today. So thank you very much for your patient hearing. I look forward to your feedback and your comments, criticisms, and your opinion on the different things we discuss. And this talk has been possible with help of all these people who are putting either inputs or gave me a lot of ideas or helped me in designing the slide. I'm a novice as far as slide making is concerned, in fact. So these people helped me with all these things. Thank you very much and open for discussion.
There were some questions about knowing the poll results. Unfortunately, if we re-poll, we will lose the previous results. So if you don't mind, I'll just flash the results once again. I'll try to capture it on by using the print screen option. So
okay.
When we relaunch the poll, the previous
okay. Then I'll just see if you can take a picture of the last poll, because there's a lot of useful information.
I'm also doing the same thing. I'm just taking screenshots. And since I really don't know a better way of doing this. So.
That's fine. Screenshot is fine. We can get it from you later on. It doesn't matter at all. We can move on to the. You got it?
I'm down to question 5. I will just.
Yeah, sure.
Actually, I should be using the share option. Sorry. So everyone can see. I'll just go through it once again. Is reproduction a fundamental right? 100% of people believed it was so. And if yes, is it the right of an individual or couple? The opinions divided. So 86 people feel that it is a couple anyway. Infertility, whether it's a disease, disability, or symptom, I think audience is confused. Maybe they'll have some clarity after listening. Then who owns the embryo? 90% of people believe it's the 90% of the people believe it's the couple. And do embryos have rights? 50% of the people believe embryos have rights. And slightly less than 50 people believe that a child's right overrides that of the patient, of the parent when it comes to disclosure of heterogeneous conception. So people don't think designer babies are acceptable. Like you said, probably most of us don't even understand what it actually means. And almost 70% of people believe that a woman can be a mother even in her 50s. And so there was no option after 50. I think that's why we were trying to give only 4 options. And for men, most people believe probably 50 is old enough to have after 50 is not so great to become a parent. So thank you. I will stop sharing. And whenever you want to run the poll again, we can do that, Dr. Pandiyan, but the results will be of the new poll. Over to you.
Okay, thanks. Thank you very much, Vidya.
Excellent talk, Pandiyan. So you've covered most of the things what you have done. But what I would like to just point out to you, you were one of the persons who formed the national guidelines in 2012, along with Dr. BNC's as a head. So that was a guideline. So it had a lot of lacunae. Today, the law has been passed. So whatever is your questions, we have the answers in the law. we cannot deviate. We cannot ask any question about the law. For example, in the law, it is just says if the woman has crossed the age of 50 by the midnight of the day of the treatment, she is not eligible to get a treatment. So we cannot argue on that particular level now. Now, the law almost very clearly says it's a question of, how you can debate with the law and then win is a different issue. But we just have to follow exactly as per the norm. So most of your questions are answered by this 2021 law, which has been passed now. Now, I would like to just start off with a basic question. A couple walks into our clinic with infertility. So we see a lot of advertisements saying that I will give money if you don't get a baby in 3 years, 3 attempts. Or somebody says that my results are 56%, and somebody says my result is 32. What is the benchmark, and what is exactly we have to talk to them before we enroll them into the program? That is our basic ethic to start with in the treatment part of it, right?
Wonderful. I think this is something much more than assisted reproduction. In fact, one of the founding principles of medicine is do not promise cure. This has been since immemorial. We have been told from our early days of practice, as a doctor, you do not promise cure. You only promise the best possible treatment. So to say that you will guarantee you pregnancy in 3 is totally unethical. There may not be a law against it. It's totally unethical. And success rate is something which patient get carried away. Your success rate depends on the patient group you treat. If you treat all couples who walk into your clinic, because that's what they're coming for, then your success rate is going to go down. And if you're a tertiary referral clinic, you have women who have been treated elsewhere and they come to you, your success rate will go down. But if you pick and choose only young couple, married for short duration, then your pregnancy rate will go up. In fact, this is what people do. Many clinics all over the world would not treat a couple at 40 years. They straight away counsel them for donor eggs. They didn't come to you for that. You should at least give them a trial of 1 cycle of, if they don't respond, it's a different matter. Just look at the low ovarian reserve. Low ovarian reserve is not a point against pregnancy. But people unfortunately decide that and say, no, you are low ovarian reserve, go for donor egg. These are because they are only concerned about the success rate. Remember, success is treating the patient, not the disease alone. You treat the patient with the disease, not the disease. You are only thinking of IVF success rate. No, the patient should feel the satisfaction that she has been given the maximum treatment. As far as the law is concerned, I totally agree with you. That's why it's an ethical dilemma, not a legal. Legal things are very clear. The law says you cannot do, you cannot do. I was in Brunei, they don't allow third-party reproduction. There is no debate about it. There is no third-party reproduction. That's all, simple, period. But the point is, legal issues have to be discussed on a different forum, because how did I arrive at this 50? On the midnight of 50, does she suddenly become old? That she cannot have a child at 49 years, 364 days, she can have a baby, she's fit. So this is what we feel as continuous debate, because people are living now. 50 was old, today 70, I don't feel old at 70. I don't want to feel old at 70. So why should you say that 50-year-old lady is old? If she's fit enough, medically fit, she should be allowed. We had patients who are not medically fit at 25 years. So we have to refuse treatment for them. That is why I feel, yes, if the law is there, you cannot break the law, but please work to see if you can amend the law. That is possible. You can always question the law and get it changed. Move the age from 50 to maybe from a few years down the line, the longevity may be longer, we may move it further. That's what I feel. And about this guaranteed success rate, it's all very, very unhealthy practices. It's totally unethical to claim that we will guarantee you success in 3 cycles. First principle in medicine is do not guarantee cure for a patient. And this percentage success is you can play. The denominator can be changed. You change the denominator, you have 10 pregnancies out of 50 patients who opt into your clinic, is 20%. Change the denominator. Make it say patients who had embryo transfer, then it becomes 40 denominator. And say only 2 embryo transfer, then it becomes 30. You can go on modifying it. So it's playing with numbers. And I agree with you, it's not ethical at all.
And just for the sake of audience, Pandiyan, could you just highlight what is the reproductive autonomy?
Yeah, well, I think I see another hand also. Individual has got a right to reproduce or not to reproduce. In fact, it's not the rule that we can say you must reproduce. In fact, the problem comes when it is a couple. The man wants the baby, the woman does not want the baby. She wants to terminate the pregnancy. She has got she's the person carrying the baby. Though the baby belongs to both of them, she's carrying the baby, she's got the autonomy or the right to terminate the pregnancy. And a person, as you saw in the other patient, the embryo has been produced by both of them. Man had a contribution. He can refuse to allow the embryo to be transferred to the woman, saying that I have a contribution to the baby, so I don't want this baby to be born to her. This is where the dilemma comes. Technically, yes, she cannot have a baby unless she goes through the embryo which has been frozen to be transferred. But this man does not. He has got the autonomy to refuse the baby to be born. And reproductive autonomy is an individual has got a right to reproduce and not to reproduce. Both are the person's right.
Gopi, 2 hands have gone up, Lata and one Galaxy. So can we ask Lata to?
Yeah.
For that, Dr. Nirmala, we'd like to hear from you also, and then we'll go on to the audience.
No, it is very nice seeing Dr. Pandiyan, who was our mentor when we were students. Both Radha Pandiyan and Pandiyan we look up to, and thank you, Vidya, for asking me to be a moderator. And Pandiyans are also very nicely brought out the legal from the ethical one. You can have a legal stand, but whether it is ethical is questionable. So there are more, with the uterine transplant also, we will have a lot more debates, which is coming up now. So we would like to hear from Lata, her question.
Sir, yeah,
Lata,
Dr.
you can turn on your camera as well.
Okay. So as usual, fantastic talk. I mean, it's always pleasure to listen to you, and you bring out the real dilemmas, and I mean, it's something which even PGs can go back with clear ideas. My question is about designer babies. I understand, okay, HLA typing is important when they're paying for so much. Obviously, they would like to, but where is the limit?
These are catchy terms, designer baby. In fact, as you very well know, when you say designer baby, people think that you can have a very intelligent baby,
yes,
you can have a very athletic baby or a very musically talented baby. All of these features, intelligence, athleticism, musical talent, all these are not just inherited. There is no single gene for intelligence. They are all, as the common saying goes, intelligence is 90% perspiration and 10% inspiration. If there's a gene, there's no gene. If there is a genetic contribution, it's only 10%. 90% is perspiration. That means you have to work hard. Ask anybody who was in the top how much effort they put in to become the top. Except politicians who can come by default. All of the people, any talent, any intelligence, it requires a lot of effort. So to think that a designer baby, you can have an intelligent baby, a Michael Jordan and a Michael Jackson and a XYZ to fit in, and it won't work at all. It won't work because there are 23,000 genes. And genes are not like they just translate to intelligence. There's a lot of interaction between them. There's a lot of misconception about designer baby. Even with editing, you can only do limited editing. You can't have these things edited completely. And when you do, this is the problem. Gene therapy has become a huge issue because when you try to introduce a single gene into an embryo, you do not know what are the collateral effects. All this precision bombing doesn't work. People say precision bombing, precision editing. There are collateral effects and there are other genes which are going to be affected. And that's what happened. So people landed a big problem. So designer baby is not a reality as science stands today. Whether it will become a reality tomorrow, I am doubtful because these germs are not sitting in isolation. You can take one and put another. They're all there, they don't even exist until the time of division. Until then, they're all in the nucleus. So how are you going to edit a gene except for a few diseased conditions where you know where it is?
Exactly.
All these conditions like athleticism are all not single gene. So designer baby is not a reality. What's the reality is avoiding genetic diseases that you isolate, particularly single gene disorders. Polygenic disorders, that's again a very nebulous term, polygenic. Nobody knows which are the genes involved. You use the word. It's easy to say a word and put off people. You know, type 2 diabetes is a polygenic disease. Nobody knows what the genes involved. Type 2 diabetes is a disease of lifestyle, not a polygenic disease, but that's another debate. So this is where it comes. So design a baby is not a reality. In fact, we had an article in ICMR journal, if you invited article, saying that design a baby is not a reality yet. So these are the issues. It is not going to be reality in my lifetime. I'm very sure about it. From where things is progressing, whether it will become a reality. What we can do is we can design to prevent a baby. An abnormal baby can be prevented. Today we are doing it. If we have genetic abnormality in the family, identify the embryo, don't transfer the embryo. Or have a baby with HLA compatibility so it can treat the previous embryos. Beyond that, designing is not possible. Have I answered your question?
Yes, sir.
We've got another hand going up. Can I ask the Galaxy Tab A
Yeah.
operators to please ask the question?
Please identify yourself.
Yeah, I'm Vidya. This is Shanti here.
Can we see you, Shanti?
Yeah. Wait. I'm just stuck with this. Yeah, I'm Dr. Shanti. I'm actually Dr. Pandiyan's classmate. And I know Vidya and Lata and all. Mrs. Sanathakrishnan. And thank you, Pandiyan, for your very nice presentation. It was quite informative. I have only one point. That is the ART, ethics and legalities, should not stop with just the outcome, that is the birth of a child. It should take into consideration whether the parents are fit enough to give a stable environment for the next 20 years. For example, older women, she might be fit at the time of birth, but she is definitely older. A 70-year-old will be definitely older than a 40-year-old. That's my point. So you have to take that also into consideration while framing your laws and other issues.
Would you like to respond to that, Dr. Pandiyan?
Well, your point is well taken. This is exactly what's the debate about. Should we be offering people, whatever age, again, you say you are guiding us 20 years more. But what happens when people who are younger and who have medical disorders? Should we be expecting the lifespan to be 20 years? Who is going to guarantee that? Should we refuse? I don't know. I'm confused. As I told you, after being in the field for 45 years in reproduction and 37 years in full-time infertility, I have no heart to tell a woman who comes at 50 years and say, I'm fit, I'm medically fit, you can text me for whatever you want. And then why do you want to refuse me? Because that's the only hope of having a baby. And it's happening all over the world. So to me, it doesn't sound right. And what is just 20 years? What is the criteria? If she's rich enough, again, rich enough means what's rich? How much should she have in bank balance? So if this is a fundamental right, how can we tell her, look, you are 50 years, you will not live for another 20 years, or therefore I will not allow you to have a baby. And we don't apply the same formula to a man. Are we being sexist? Woman has been criticized so badly. In fact, the people are condemning, say that she's very selfish. What when a man goes around and has a baby at 60 years? Oh, he's considered a hero. Is that the right thing to do? All I feel is, my point is, if she's medically fit, you can never predict how long she's going to live. From all predictions today, we know that the lifespan in India is 69 years. So in 50 years, the poll voted 50 years for a woman. Yeah, 50-year woman comes to me clinic and say, I want to have a baby. You have embryos, frozen embryos, which a couple are willing to donate. So I want to go through donate embryo program. Do I have the right to refuse that treatment just because she's 50? I don't know. I want your answer, and you, Shanti, says no, you should not treat her because her lifespan is probably limited to only 19 years. I look at your point. I welcome your point, but I'll have to think it over. And of course, all decisions in A.R.T are made by the team. In fact, we don't force our decision on anyone. All is a team effort, so we put it to a team. And sometimes we go back to the ethical committee also. Sometimes we differ from the ethical committee. I think I'm still around the last meeting. A young lady came to me at 35 years or 32 years, wanting to have a baby. She had chronic liver failure, and she was a candidate for liver transplant. She was not an extremist. She was not bedridden. She was moving around. She said, I don't mind dying, but I won't have a baby. He's only 35. The ethical committee said, go ahead. You are the center of excellence. You should do it. We said, no, we will not do it. We don't want death in our hands. And they all, as like Shanti said, we do not know a lifespan. If you have a liver transplant and then they clear you and say, then it's a different story. Now with the chronic liver failure, impending transplant, we don't want to do. These are the issues like uterus transplant. Uterus transplant is putting a woman on immunosuppressant. And the baby is being exposed to immunosuppressant from day one or even before conception. Should we be doing it? And the alternatives are available. So these are huge issues. The law is, as all of you know, law is a point in time. Surrogacy, international surrogacy was allowed in this country a few years back. Now it's banned in this country. It may change tomorrow, again, depending upon the law being reviewed. That's why I didn't bring the legal issue. Legal issue, whatever law says, Gopi said, 2021, you have to abide by the law until you can change the law by going to the court or allowing it. But the moment you're discussing ethical issues, to me, it doesn't sound right to refuse a woman if she's medically fit, even if she's 50. I'm willing to be disagreed upon or criticized. Thank you.
Today morning in the papers, there was a news that the court has allowed a 17-year-old to donate liver for a father who's having non-alcoholic liver disease. So I thought that was a huge red light for ethics, because we think up till you're 18, you're not fit to vote, you can't marry. I mean, you can't even consent for your own surgery. But the court actually decided to allow. So maybe something like some recourse like that would be possible for a lady who's 50, because the law doesn't allow at 50. Maybe she can move the courts and maybe the courts will be favorable. I don't know. Dr. Rajaram, you've been very quiet. We'd like to hear from you, sir. Unmute yourself, sir. So you need to unmute yourself.
Vidya, on your point about the age. Age is a very arbitrary criteria. See, the strange thing about age is, in USA, you can drive at 16 years. You can drive around and kill people. And suddenly, and you can only drink at 21 years. Why? These are arbitrary things. There are no guidelines at all. In fact, there's a thing called Gillick's competence. As per Gillick's competence, a child at 12 years is competent mentally, can give consent. So this is suited for this case, because father needs a liver, son is willing to donate. So say age has been advanced to 17. The court decided to push it further. As you said, it can be moved this way or that way, depending upon the judge interpreting it, and then nobody challenging it. So it's not any hard and fast, not written in stone that cannot be changed. We're waiting for Professor Rajaram.
Thank you. Thank you, Vidya and Pandiyan and Gopinath. I think it has been excellent talk, and plethora of issues were raised. And of course, I've been driving in USA for the last 40 years with a license. Now, the whole problem is that it has become a political, social, and ethical issue, but the ethical part is completely forgotten by many of the obstetrician gynecologists. Now, I remember, I don't know whether you'll agree with me or not, in 1966, when I became an assistant professor in Osmania, my professor, Dr. Surti, after having heard about the uterine heart transplant, he asked me, called me, and he said, why don't you try uterine transplant and ovarian transplant? All of us laughed, and my colleagues laughed immensely. And today it's a fact that is being done. So what I wanted to tell you is that the obstetrician gynecology, when you get into the outpatient, you can see how many patients are with infertility have come to you. You can see, looking at their faces. I used to diagnose the faces and just take them. And I also even gone to the diagnosis of what are the factors in that. Based on my experience in 1960s, when I started the first male infertility clinic in Hyderabad. And later on, the JIPMER's first male infertility clinic was started by me, because I thought the obstetricians must know that before they examine the women, which of course is common, this thing, that they must know what's the social issues that are involving. Now, for example, in Hyderabad, I've seen that the social issue was mother-in-law in a rickshaw pullers, this thing. Because when I asked that fellow, I said, how many rooms you have in your house? He said, only one room. Where do you sleep? I said, we sleep on the cot. Where does your mother-in-law sleep? Mother sleeps? She says she sleeps under the cot. There lies the factor of infertility. We asked him to take a 2-bedroom a flat 2-bedroom house and there was a child after 1 year. So these were some of the issues that I thought it's very, very important for us to know. Although the social and political issues, besides that, the plethora of issues that were involved, Dr. Pandiyan has brought out very well and it's being discussed very well. One thing I know that recent research has shown, it's published in Science magazine, that 100 years ago, I mean, it was 100 million sperm count about 50 years ago. And today it's only 50 million. That is and the reasons are social issues. Social issues, drinking, smoking, and other habits. So I don't know what it is, but I know this much, that the Pandiyan has brought out the life issue. I know this much, that I would like to quote a small poem. Life, I know not what you are. I know that thou and I must part. I know not when, where, and how shall we meet again, maybe in the form of IVF. Thank you very much, Vidya, for asking me to say a few words.
So Dr. Venkatesh has typed an interesting question in the chat box. Dr. Venkatesh, would you like to say it yourself or you want me to read it out? Dr. Venkatesh?
Ma'am, I'm a little bit on the outside, so I think you probably can read it for us.
Oh, okay. So Dr. Venkatesh says, why do people gravitate towards having a biological child rather than adopt? Is this a human condition which has a biological basis or more of a societal or cultural pressure? When do we encourage adoption rather than assisted reproduction?
That's a fantastic question. I'll tell you a small incident. This was in 1988 again. I was running a department in Government General Hospital. Again, a man came from Salem. I still vividly remember. He had a similar condition like I told you before. Sexually only syndrome, nothing is possible. So I counseled him and told him the option. Like, we always tell them adoption, child-free state, adoption, and heterologous insemination is the third choice. Within a few days, I had a registered mail to Government General Hospital saying that I spoke to my wife. She's willing for donor insemination. I'm coming 3 days time, whatever it is. I mean, my fastest response, there's no email those days. Fastest response was to go across to the post office and send a mail to him saying, don't come immediately. This was 88. I had no program of donor insemination, nothing at all. So he came later on to discuss with me. I asked him, why don't you adopt a baby? The simple answer he said was, sir, for those people who can't follow Tamil, I'm telling you, all this is not acceptable to our community. He said, he said, he cannot have a baby, so he's gone and adopted a baby. This will be the comment for the community in a village. Adoption is not such a big problem in a city, but it's a huge problem in villages. Because they feel that it's a very clear thing. You can't hide a situation at all. So they feel that the community or the society or the relatives will laugh at him, will criticize him, and therefore this is exactly what it is. And even today, adoption is not easy. And adoption agency, in fact, when I counsel some couple for adoption and they accept it, they say they don't make it simple. There should be laws, legal legislation, but it is so unpleasant for the couple to go through it. There's a police verification, and the police will come and ask them, I believe, I mean, the crude way they handle them is not handled with gentleness at all. So many of these couples feel very unhappy. They attempt adoption, they give up and come back for treatment. So I strongly accept the suggestion. I agree with the suggestion, yes, adoption would be the first best option. But unfortunately, many couples are not willing. But I was surprised that donor insemination was accepted so much because I thought with the man's ego, it will not be accepted. This man from Salem was the one who woke me up. Until then, he never thought of organizing a donor insemination program. He woke me up to the reality. And today we feel that donor insemination is far more accepted than adoption if you take overall incidence.
My take on that question, there are two basic things which happens when you adopt a baby.
Dr.
Number
Gupta,
one
could
is,
we have your video on, sir?
Yeah. So number one, here by adopting a child, the taboo, the social taboo of infertility is not removed. That is one. The second, the most important thing is, so by adopting a child, you are throwing it to the community one of you or both of you has got an irreparable problem for which the infertility cannot answer, the specialist cannot answer. So that is the main important thing with which they just hesitate to go in for an adoption.
No, I agree with you, Gopi, because when we talk about uterine transplant, where the lady is willing to undergo a major surgery, think of a lady who is born with uterine agenesis or Mayer occupancy. She is willing to go through immunosuppression, major surgery, and as Pandiyan sir said, exposing the unborn child to the immunosuppression, having the baby, getting the uterus removed after that rather than adopting. So it's a social and a mindset. I think we should be talking about adoption, more in the society. All the ART couple also, when they come, we should be talking to them in a way it is acceptable to them. It is happening in the West.
Another valuable point what Dr. Pandiyan brought out is when the couple wants to adopt, there has to be a smooth, straight line where you produce this, go to the central registry, get yourself registered, get that number, go to the adoption center, show the number, something like your NEET examination. As per your priority, you should be eligible for adoption. So that should be the ease at which they'd be. See, I have seen people whom I have given the adoption certificate. They've all registered. It's about 2 years they are on the waiting list. So that probably, if they have come to know about it earlier, they will not accept adoption.
Very true. Adoption is not such a simple procedure. Though on principle it is simple, in practice, they go through a lot of hassle. Gopi said, we have to make it simpler. We have to counsel them, keep counseling them, and also make it simple. Counsel them and send them, and they are so frustrated and come back. That's also happened. So we should make it simpler. I think it's all our responsibility to talk to people, authorities. Don't harass them, don't make them feel small, and encourage them, and also ease the process of adoption with all the checks and balances. True.
Dr. Shanti, you have your hand up again. You wanted to say something?
Yeah, I just wanted to tell about adoption, why people don't go in for adoption. One is, I have heard, it's not a study, I've heard several case reports where the children feel rejected. They develop some behavior problems. So the children feel that they have been rejected by their biological parents and somebody else has just brought them up. So that the deep scar remains that they were rejected by their biological parents, and that has caused some behavior issues. Secondly, this adoption now is being practiced by people who have biological children of their own. Many of my friends have got 2 or 3 children. One will be their biological child and the other will be an adopted child. So if that is so, then the stigma of adoption will go away. And I think if the rate of adoption keeps increasing, the children, since it becomes the norm, the children may not develop behavior, they may not feel rejected. And they feel, oh, it's okay. Are you adopted? I'm also adopted. That way, they might feel more at ease.
So just for argument's sake, madam, I think for want of a better word, orphan child, I'm sure is going to feel much more rejected when he's not even adopted and sees other children getting adopted. So I don't think an adopted orphan is likely to have more psychological problem than one who did not get adopted. That's just my
This is what I heard.
Yeah.
Because
no, I have seen that. I have friends who, like you said, who have biological children and have adopted. And I have seen them going through struggle, and the child also going through struggle. But my hats off to them for having the courage and thing to go through all that, including children who have known medical illness. There are parents who adopt, so hats off to them. Yeah. So, Dr. Pandiyan, you wanted to say something, sir?
No, I just want Professor Rajaram to give that nice quotation. You have a beautiful poem to share it with us. I cannot catch all of the words, so it would be nice if we can send a mail to you and you can share it with us. It's a very nice quotation. And I also remember Khalil Gibran's famous quotation, "Our children are not our children." No, I don't know. So some of you should read 7 stanza. It says that our children are not our children. They are going through us. And that's a reality. They are going through us. We can't hold their spirits with us. They are the future. So we must give them the scope to develop on their own, to give them wings to go around, roots to be. So that's a beautiful quotation. And some similar I heard, wonderful, nice from Professor Rajaram. So I'd be happy to get a copy.
Dr. Rajaram, you're muted, sir. Rajaram, sir, you're muted.
Yeah, I just wanted to say that, about 25 years ago, I recommended, a lot of people, my patients are adopted children, but 2 examples I'll tell you that now they are aged 25 years, and both of them are rascals, I tell you. The one girl married 3 times, and she doesn't want to listen to her parents. And the boy, they're trying their best to make him at least a graduate, but he's not become graduate. Instead, he's having girlfriends or other things. So this is one of the problems that we must think, because both the families, their lives have become miserable, and they are blaming me now for having advised them to adopt a child. So this is a big problem. I think Pandiyan and others may advise what to do.
So this is presuming that your biological children will all turn out to be angels, which is far from the truth. Yes, Lata, sorry. Yes, Lata.
Like marriage is a gamble, adoption is also like same, I think. So I have my own cousin who was very scared to adopt, but finally the age limit for the husband was 45 years. That's what was I'm telling 25 years ago. Finally, she adopted, and unfortunately, the child had, maybe the mother tried to abort her or whatever. Child has very aggressive behavior, but they're taking care of the child. So these problems will happen, but
Lata, the families have they are ruined. The families are ruined now. True, economically, socially also by adopting.
It's not just, okay, because they have adopted, they may be feeling, okay, I shouldn't have done that. What if, as Vidya said, if their own biological children behave like this? So it's a gamble.
Guarantee that your biological children are not going to behave.
Exactly.
So still that
so you don't take the blame
is in their mind.
Agreed.
Well, life is a gamble. All of us have to accept it.
It is.
So this is true of adopting our biological children. And
so how do we know all the IVF pregnancies tomorrow, the children will behave very well in spite of knowing that the parents have, taken all that trouble to get them into this world? It's not, I think all, there's no answer.
So, Puvitra, we'd like to hear from you as a student and a colleague of Dr. Pandiyan.
Hello.
Can you turn your video on?
Yes, ma'am. Yes, ma'am.
Who is this beautiful woman? No picture. Now I see.
Vanakkam, everyone. Vanakkam, everyone. I'm sorry, I'm having my phone in my hand, so I can't say Vanakkam properly. So, yes, ma'am. I'm proud to say I'm Professor Pandiyan and Dr. Radha's student, and I'm trying to walk in his path. So, trying my best actually. And as I always say, he's the epitome of ethical practice. And whatever he said, as others said, law is different and ethics is different. There are so many gray areas in the recent A.R.T. law, which has been, which has come into play, but still the ethical questions, even within the law, is still so confusing for many of us. And we hope that we are still able to continue, me or any of the students. I think we will try to continue whatever he's taught us. And we really enjoyed his talk this time, as always. Thank you, ma'am. Thank you, Dr. Vidya. Dr. Vidya was my anesthetist when I had my normal delivery. She was the one who gave me epidural. So thank you very much. Thank you very much.
Congratulations that you had a normal delivery.
Nice to see pictures of your family on Facebook.
Thank you so much.
We have a senior obstetrician, Dr. Syed Habibullah, who is also my teacher, like Professor Rajaram. Dr. Habib, we'd like to hear from you, sir.
40 years ago, I was an infertility man along with Dr. Rajaram. But then somewhere down the line, I deviated from the infertility, went into other fields. And I remember those days, early days, how Dr. Pandiyan used to struggle to establish his andrology clinic in the government hospital. And really, I know at that time, I used to go to see Dr. Radha and Dr. Pandiyan in Apollo Hospital. And transvaginal sonography was new to me at that time. Dr. Radha was kind enough to show me at that time, taking patients' permissions. Imagine in Apollo Hospital, paying patients, taking their permission and allowing a man inside and all that. And then after that, of course, we used to have dinner and movie with Pandiyan. I remember those old days. And his parents, they were so affectionate to me. I stayed in his house, enjoyed their breakfast, dinner, lunch, everything. He was so nice, both the couple and their parents. Thank you very much. It was a wonderful talk. There is no need to, I have put in the message. There is no need to say anything. Pandiyan is talking means all these days I was not there, Vidya. Today I joined because Lata reminded me that today Pandiyan is talking. Nice to see all people, including Professor Rajaram, Gopinath, Dr. Nirmala, and Dr. Puvitra also, with whom I interacted some time ago, some years ago. Lata, bye.
We have Dr. Saubarnika. Saubarnika, would you like to say something, or do you have a different take on what was discussed today?
Hello, ma'am. Hi, sir.
Can you turn your, are you in a position to turn your camera on?
I'm outside actually, ma'am.
Okay. No.
Sir, yes, we learn ethics from sir, as always. Each and every point he brought in today was the one we always used to discuss in our open house discussion, which is a special discussion we have it in Pandiyan sir's room. We are very glad to be trained under such person, Pandiyan sir and Radha ma'am. We hope and believe to keep the ethics up in the whole of our practice. Thank you so much.
Thank you, Saubarnika. Nalla, you had your camera on briefly, but do you want to say something, Nalla? Nalla Shivam is from Dubai, my college mate.
I can share the UAE, the UAE experience. When I came to Dubai, I was surprised. There were no IVF clinic or IVF centers at all because it was banned by the law. So the law had clearly said IVF was not allowed. Then over a period of years, IVF was slowly introduced, and now we have taken it to a different level. So I've seen the time when there was IVF was banned, then there was a lot of adoption being done in UAE. Now IVF is still on. I don't know if a law can give some straightforward clarification about, like a lot of us are talking about the law, 50 years or 40 years or 30 years. Why not law give clear clarification? So when they had this thing, no. And when it came, yes, it was allowed. And then they did take it into a different level with pure, it's scrutinized completely. So you cannot have any foul play anyway at all. And the guidelines have been set. They've been revised by the Royal College. They've been revised by American College. And that's how these guys form laws when they used to put in. So I think we should take the goods and bads of the law. That's what I wanted to share. Thank you, Vidya. I don't know if it's something which people like to take.
Do you have any closing comments, sir? We are almost nearing our closing time.
Did you ask me?
Dr. Gopinath?
Yes, it was indeed a great evening, Pandiyan. So first of all, to see you and Radha and all the seniors here, and especially Dr. Rajaram on the screen is really nice. And we had a very difficult task of going through the ethical issues, which mostly it is only a success-oriented ART practice we are seeing it day to day, whereas the ethics is not being applied on every step what we have just discussed it. And it is really nice you to have just come and shared all your things. And thank you very much, Pandiyan.
Thank you very much.
Yes,
Dr. Nirmala?
Vidya, no, just like to thank Vidya for this wonderful opportunity to meet Sir and Radha Madam. When he came on the screen, I thought he was still in Chettinad. So lovely to see him from Los Angeles. And I fully agree that, infertility being a money spinning specialty, there will be a lot of ethical dilemmas. And Sir brought out everything. At the end of the day, we as a society, should take it forward. I think it is on every individual's onus to make sure. And I very fondly remember our postgraduate days under Pandiyan sir, and sir cannot be anything but ethical. So it was a lovely, nice topic which was chosen to be given to sir, and it was wonderful listening to the comments of everyone. Thank you, Vidya, for the opportunity. Me and Gopi would like to thank you for being made as a moderator for today's session. Thank you, sir.
Thank
Thank
you,
you.
Dr. Nirmala. Your final words, Dr. Pandiyan.
No, I'm overwhelmed meeting so many people. In fact, as Nirmala said, I remember the days when she was our brilliant postgraduate in maternity hospital Igmo, and Gopi was my beloved brother, and from KMC, and they're all prize-winning students. Professor Rajaram, in fact, I know that he's still listening. I remember the great workshop he conducted in Jipmar on, there used to be one person called Amod Prakash from Banaras Hindu University, who used to talk about if there can be milk booth, why not labor booths? So there are, you brought in a lot of pleasant memories about the past. It's around, it's nostalgia, and it's walking on memory lane. On top of that, a lot of feedback. In fact, I don't know whether we didn't get the question for the
You want to repeat the poll, sir? I can do that now.
If you can do it, if people are still around,
I think
whoever is around can answer it. So that, there is a change of opinion, just to see that.
Yeah. So I have launched the poll a second time, and I should have done it a little earlier. I'm sorry. There are about 30 people here now, and you can scroll down and answer each question again, where we'd like to see if today's talk has changed anybody's mind, or what's the impact of today's talk. The poll is anonymous, so please feel free to answer. I request everyone who's still logged in to take this poll again. Just want to know whether your ideas have changed after the talk. Use the scroll to, are you able to see the poll?
Yes.
I'll give it another minute. I request everyone to take the poll. It's anonymous, and it's just for taking feedback. So while people are still answering the poll, I'd like to thank Dr. Pandiyan, whom I was introduced to, and I must thank Tilaka for introducing me to Dr. Pandiyan. I mean, I live in a real small pond, so the people I know are very few, but Marvelous Medicine has helped me reach out to many old friends, new friends, and rub shoulders with giants in the field. So thank you, Dr. Pandiyan, for readily accepting and also embracing the Marvelous Medicine family. And sir has suggested many more controversial topics, which we'll be taking up in the coming days. I'm going to take your permission and end the poll and show the results. So, Dr. Pandiyan, strangely, from 100%, actually now 93% only feel that reproduction is a fundamental right.
Yeah, I see that.
Yeah,
yes.
I think maybe some people abstained, not realizing that it's an anonymous poll. So that's question number 1. And then question number 2. Yes, a fundamental child, whose it is, it's still geared towards the couple rather than the individual. And if at all, if it has to be given to one person, it looks like people think the woman has a more right than the man. And the confusion about what to call infertility is because of your comment. Now, most people think it's a symptom. People actually have been listening to you, sir. Who owns the embryo? As you seem to have convinced a small portion of people that the government probably should take care of embryos that are not being claimed. And already everyone believed that the embryos have rights, and that stance has not changed. Children's rights has increased by say 5 or 6%. And a smaller, once it is known what exactly you mean by the colloquial term designer baby, there are some people who now feel it's acceptable when initially almost everyone felt it was unacceptable. And many more people feel that 50 is not too old for a woman to have a baby. And same with a 60-year-old male. Thank you everyone for participating in the poll. I will stop sharing the results. Your closing comments, Dr. Pandiyan.
Yeah, it's been a great experience, both in terms of meeting so many people. I'm so glad about that. And also the great feedback I got from all of you, because a lot of misunderstanding is there about many aspects of assisted reproduction. And I'm glad I got the useful feedback from all of you. It's been a learning experience, and I hope to learn more from the future of marvelous medicine. In fact, I'm looking forward to the debates also. In fact, as someone made a remark earlier, we don't want to just have a monologue. We want a debate and a discussion about it rather than hearing. So thank you very much, Vidya. Thank you very much, Patta and marvelous medicine team. And Nirmala, Gopi, it's been great meeting you all again. And other people, Professor Rajaram, of course, I told you, it has been great. And I'm glad he looks the same. You look amazing. Last time he said, I couldn't believe it, whatever age he said last time. Nobody would believe it. I don't want to tell the age because looking at people think he's still in his 50s or whatever it is. So it's amazing, and I only look forward to being like him when I reach that age, if I reach that age. Thank you very much. A great morning for me. Good beginning. Thank you very much.
Thank you so much for your kind words, sir. For those of you who celebrate Christmas, advanced wishes for a Merry Christmas. And we'll have one more episode, the last episode of this of 2022 next week. So we'll meet again next week with yet another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.
Right. Good night.